And here is your question. Right, so if you have read and understood, considering this surgical anatomy station, kindly identify, right. Kindly identify what are you looking at. First of all, describe, please. Can you please describe
This
what
is
are
the
you looking at? Yes.
this is ma'am the interior surface of the skull. We are viewing it from the above.
Okay, very good. This base of the skull is divided into certain foci. Can you please explain how and how many?
Yes, madam. This portion of the skull is divided into three broad areas, that is the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. The anterior cranial fossa is bounded anteriorly by the frontal bone, posteriorly by the anteroclinoid process and lesser wing of sphenoid, and laterally by the parietal bones. The middle cranial fossa is bounded anteriorly by the lesser wing of sphenoid, anteroclinoid process, and posteriorly by the petrous part of temporal bone. Posterior cranial fossa is then bounded anteriorly by the petrous part of temporal bone and dorsum sella, and posteriorly by the occiput, and laterally by the temporal
Okay.
bones.
Can you please tell me what are the bones which form the posterior cranial fossa?
Ma'am, anteriorly it is formed by the petrous part of the temporal bone, and anterior, that is the anterior boundary. The posterior boundary is formed by the occiput, and laterally we have the temporal bones and parietal.
Posterior cranial
Sorry,
fossa,
temporal
it's
and
temporal,
occiput.
parietal, and occipital, just three bones. But I wasn't
Yes.
asking you for the boundaries, so you have to listen to the question very carefully. All right, can you please identify
Okay.
what is number 11, please?
That would be the foramen magnum,
What passes through it, please?
spinal cord, vertebral arteries,
Anything else?
accessory nerve.
Yes, what about the meninges and many other things passes? So, all
Uh,
right, since
the
we're talking
tectorial
about,
membrane, the apical ligament of the dens, and the
yes,
meninges
now
as well.
you're telling me, you know everything. All you have to do is to just compose yourself. All right, can you identify number 13 over here, please? If you can see where my cursor is.
Ma'am, that's the jugular foramen.
What passes through it, please?
Ma'am, the glossopharyngeal nerve, vagus nerve, accessory nerve, and inferior petrosal sinus and sigmoid sinus.
Okay, right. Jugular foramen, right. Okay, can you please also identify which number is, if you can identify which number is foramen rotundum? Can you identify foramen rotundum?
Ma'am,
In
that's
which cranial fossa would that be located?
that would be in middle cranial fossa,
Very
and
good.
that is the number 13.
Okay. Yes. Now please tell me what passes through it.
And the maxillary division of the trigeminal nerve.
All right. Okay. Can you also tell me that here? Okay, what passes through here in the anterior cranial fossa? There is number 6 or 5. What passes through the cribriform plate?
Then This is the cranial complex of the ethmoid bone, and the olfactory nerve roots pass through here.
Okay. Which one is foramen ovale?
Number 12.
Okay, here. Why the,
Yes.
okay, what passes through it?
Ma'am, the aortic ganglion, um, the accessory meningeal artery, the
It's
emissary
ovale,
veins,
so
lesser petrosal.
MALE is the abbreviation. You have to remember four things passes through it. Okay, can you identify stylomastoid foramen?
28.
Okay, good. Right, 20th, right, okay. Can you please tell me which bones form pterioin?
Sorry.
Which
Okay,
bones?
okay. Yes, I got the question now. The parietal bone, the sphenoid, squamous and temporal petrous part of the temporal bones,
Four
and
bones, right.
ethmoid.
What is the clinical significance of pterioin?
The anterior division of the middle meningeal artery passes right beneath it.
Yes, middle meningeal artery, so that can lead to hemorrhage. So it's,
Yes, extradural hemorrhage.
yes, which is more frequent or more common. All right, can you please tell me, right, if you can tell me what are the types of lytic lesions that can occur on the skull?
Sorry, ma'am, can you please repeat the question?
What are the causes of lytic lesions that can affect
Okay,
the base of the skull?
okay. That could be, ma'am, multiple myeloma, metastasis, osteomyelitis, tumor from that can metastasize. Sorry, the Paget's disease,
Like sarcoidosis.
hemangioblastoma.
Okay, good. Right. If you can identify foramen lacerum, have we done that? If we've done, then you
Um,
can identify foramen
Number 10.
otendum. Okay.
Ma'am, number 10 is foramen lacerum, and
Yes.
14 is foramen,
Rotundum.
no, rotundum is 13.
All right. Okay. One last, you can tell me foramen spinosum.
14.
14 you said was rotundum. Okay. Can you please tell me what are the contents of optic canal, please?
Optic nerve and ophthalmic artery.
Okay. Can you tell me what are the in the posterior cranial fossa? There are the certain venous sinuses tracts. Can you name few, please?
Superior sagittal sinus, transverse sinus, confluence of sinuses, straight
Okay. Can you
sinus.
classify them into single and paired? And then tell me, please.
Superior sagittal sinus, inferior sagittal sinus, straight sinus. These are unpaired,
Yes.
and paired are transverse sinuses, inferior sigmoid sinus, and the in superior and inferior petrosal sinuses.
Okay. What is the significance of these
Uh, they
sinuses?
uh, they they have they are valveless, and they
Yes.
drain the skull of the brain, and they are prone to infection from the deep area of the face via superior and inferior ophthalmic vein that can lead to cavernous sinus.
If there is information, bell has gone, but since we are asking very slowly, so I want you to complete this, please.
Yes.
Right. Welcome to the question. Okay, when there is thrombosis of cavernous sinus, how would a patient present to you?
He would typically have fever, photophobia, proptosis, and ophthalmoplegia and cranial palsies of third, fourth, fifth, or sixth nerve,
These are the
mainly
signs.
of the abuse and
Yes, yes, these are the
yes,
signs of thrombosis that you look for. Right.
yes.
Haven't you done? Okay. Can you please tell me If you can identify or tell me where the straight sinus would be, if you can point it out or give me an idea, or if you have the access
Ma'am,
to...
it will probably be down it will be between the 11 and 29 points. That
Yes.
point number 29, 11, it will be between this area, the occipital crest where is.
Okay. Right. What are the contents of hypoglossal canal?
Hypoglossal nerve.
Canal. Okay, hypoglossal nerve, then there is ascending pharyngeal artery as well. So you are telling me half of.
Oh,
Right.
okay. There is a single. Okay, I didn't know
What
that.
can, right. What are the tumors or the common tumors of the posterior cranial fossa? If you can name few, please.
Um, uh, Hemangioblastoma, ependymoma,
No,
ependioblastoma, and
medulloblastoma
acoustic neuroma, medulloblastoma.
and ependymoma. Two I have. Okay, what is clivus?
This is, ma'am, the point 4, and abduction nerve passes through it.
Very good. Okay. If you are asked to define clivus, how would you define it? Point 4,
Sorry,
okay,
ma'am.
you identified it. If you are asked to define it or explain it or describe it, how would you describe?
It is the area of the bone that is posterior to the dorsum sella and anterior to the
Yes,
foramen magnum, present in the occiput bone.
yes, at the
And its
junction with
significance is that
sphenoid bone. Just that. Okay, good, very good. Thank you. Thanks.
like